to make this exciting. All right, so we'll start off with lumbar. And, I mean, they kind of aided us into this lecture, which is great. So, we talked a little bit about this same kind of deal as Reed talked about last week with cervical disc herniation. Same thing happens at the lumbar region. So, big things that can happen is where, like they said, they're gonna, whenever that disc bulges, it causes the pressure on the nerve root, and then that's what they're feeling, that's what they're complaining to you guys. You know, you get that pain in the low back, and then also you can get the pain, shooting pain down the leg into the foot, and these people become very, very uncomfortable to where, I mean, you can have like a slight disc bulge and the athlete or the patient can seem pretty functional and they can do a lot more. And usually that won't require surgery at all. Like, you can do rest, they can get a steroid injection, and usually it'll heal on its own. But when you get in bigger cases where they have like a full-on disc herniation, that's when surgery is required. And that's when you're gonna, like, the patient's gonna be walking super stiff. They're not gonna wanna sit down. I mean, just by observing these kind of things, you'll be able to tell, like, hey, if they're in that much pain, whenever they get up on the table, I mean, you're gonna tell they're gonna struggle. Or whenever they're sitting down is a big thing too. Painful. So these are the different types of stuff that can happen with the disc. So the normal disc at the top, and then goes down to degeneration, and then you can get the bulging, and then it goes into the herniated disc. And down at the bottom is where that bony formation starts to happen due from the disc degeneration. Pretty much all that shock absorbance out of there, so the body's just trying to protect and build more bone. Okay. Oh, and also, I know they talked about that type of surgery, but you can also get where they will actually fuse the vertebrae together, and there'll just be no room. That's when pretty much the whole disc is ruptured and there's no possible repair for it. Kind of like a meniscus, they'll go in and take the whole meniscus out. But they can do that with a disc. But in the disc issue, they're going to fuse that together, and that usually leads to problems above and below, because those joints above and below have to become a lot more mobile than they already are. And okay, so some special tests for disc herniation. You can do milligrams, which is a bilateral straight leg raise. They just raise it up, and if they have any pain with that, pain in the back is what they'll complain of. Or unilateral straight leg raise, where you test each side depending on whichever side is being affected. And you do that passively and also actively. And then the Valsalva's maneuver is where they sit on the table, and they kind of like just tell them to like bear down like a little bit, like they're sitting on the stool, and then usually that'll recreate the symptoms and cause irritation. So then there's other ways to evaluate as well: MRI, CT scans, EMG, and bone scans as well. Usually with the disc herniation, or the signs and symptoms can be similar to a stress fracture, so you always want to rule that out as well. My biggest thing is if they have pain going back, that's usually a sign of a stress fracture or a fracture to one of the vertebrae. But if they have more pain going forward, that's usually a disc issue. Okay. And this is a word of caution, just saying that a lot of people in the population will have disc herniation, so you want to just make sure that it's that you don't think it's just a disc herniation that's causing the problem. There may be something else involved, because they can show up positive as an MRI and it'll look like it's herniated. I know I've seen plenty before, especially in growing athletes. It'll look like their disc is just bulging, but it's just room for growing actually. Or the curvature of their spine too can make it look like that as well. Okay, so nerve root compression, also known as spinal stenosis, and that is just where it's the narrowing of the spinal cord, and it just causes pain on that nerve root. Like disc herniation, you're going to be able to, they're going to explain to you, like, I'm getting shooting pain down my leg. They'll also have, when you test their dermatomes and myotones, they'll probably have decreased sensation, weakness, depending on what nerve root it's at. Have you guys learned about any of those yet?
With the muscle testing?
Yeah, like the reflexes or
Yeah.
any dermatomes, myotones.
Yeah, heard.
So do you remember what the myotones are, like what do you test for like S1, L5?
It's from C5. Was it C5 to
For
T1?
lumbar?
Or
Like,
have you guys only learned cervical?
no, like L1, L2, L3,
Okay.
L4.
Do you go to S?
Oh, okay.
S1 is like
Oh, yeah.
So
back here.
if you suspect something like this is going on, you want to
It's like-
test them bilaterally comparison, and that'll tell you where it's at. And you'll be able to feel a major weakness with like great toe extension, dorsiflexion, hip flexion, stuff like
Yeah, this
that.
one's-
Okay, cauda equina syndrome, and that's where, so the spinal cord comes to an end at the L1, L2 level, and then below that, it's just the bundle of nerves. And with this usually only happens like in a traumatic like injury, like direct, usually in like car wrecks or something, but that's where the spinal cord or the nerve bundle is damaged at the end of that, and that can lead to paralysis and loss of function and paralysis. So it's a medical emergency. You want to get them in if you suspect this. And what they'll complain of is numbness in both legs, weakness in hips and legs, back pain, and then problems with bowel. But this can be either an immediate onset or it can be delayed for maybe like a day tops. So the history will tell you everything on this one. So you may not see that very much in our fields, but it's something to know. Okay. All right. Have you guys heard of spondies before? Spondies. All right. So it's known as like the Scotty dog fracture, and you can see where on that pars articularis,
It's
like right
the
here.
Scotch.
There's a
Oh.
fracture in there. So it looks like a collar on the little dog. It's kind of cute.
Except that collar's a broken neck.
Yeah, I know. It's sad.
This kid.
Okay, so, yeah, thinking of fracture. This can be, stress fracture. It can also be immediate as well. One good way to test for this is the single leg stance test, or, can't think of the other one, but, so they get up like this, they'll lean back, and then they'll, move from side to side, and that'll be a positive sign with pain, recurring symptoms. I've had some experience with the spondy before, and it's always been like a built-on stress fracture kind of thing. So my rule of thumb is like if someone comes in with low back pain and they've been treated and been doing exercises, been getting them stretching and whatnot, and they're not getting better within 2 weeks, like no improvement at all, I send them to the doctor to see what's going on, because usually something's going on. Because if it's just a muscle strain, then it should heal in 2 weeks, But you just always want to rule that out whenever you get low back pain. It's difficult to deal with.